Hypertension, also known as high blood pressure, is a silent killer and remains one of the leading causes of morbidity and mortality worldwide. Recent statistics have shown that over 1 billion people are hypertensive, although a good proportion of them are not even aware. Sadly, even among those who are aware, many refuse to start treatment until the dreaded complications of uncontrolled blood pressure set in. Little wonder this silent killer is responsible for at least 7.1 million deaths on an annual basis globally. According to the World Health Organization, 46% of adults in African countries are hypertensive, with adult males tending to have a higher mean systolic blood pressure than adult females. This report also shows Nigeria as topping the list of male and females with highest percentage of adult blood pressure. Welcome to this week's episode of Health Watch. I am Angela Wenze. My guest on the program today is Dr. Ejike Orji. He is a physician for 37 years, an international development expert. He has also worked with DKD in Wiesbaden, an international diagnostic center, for 9 years. You're welcome to the program, sir.
Thank you, Angela.
It's good to have you.
I'm delighted to be here too.
Thank you. So today, well, first of all, what's the meaning of DKD?
Actually, it's a short form of the Deutsche Klinik für Diagnostik, which means German Center for Diagnosis.
Okay, so it's not English.
It's not English.
It's German, and you were there for 9 years.
Yes, I worked with them for about 9 years.
All right, so today we're discussing hypertension. Just because I didn't want to define it before the program starts, so that we have the clear definition of what hypertension is. What is hypertension?
Well, hypertension is described a situation where the blood pressure is higher than what is observed to be normal. The teaching when I went to school and a few years ago is that any blood pressure that is above 140/90 on a consistent basis is regarded as a slight hypertension, and there are gradations as you go up. But the American Heart Association just came out late last year, November 2017, and they have rebased it, and they are saying that any blood pressure that is consistently above 130/80,
reducing it,
yeah, is regarded as hypertensive, slightly hypertensive. So what this means is that for some of us who have been working within the 140/90 basis, that means current research, they must have done a lot of research, and they found out that blood pressure consistently being above 130/80 already is having a deleterious effect on the body organs. And essentially, that's why they have probably come out with that definition. Yeah. Okay,
now you talked about, let's know the normal, what the normal blood pressure is.
The normal blood pressure is about 120/80.
So 120/80 would be 120/80. So that's systole?
The systolic one is 120 and the diastolic is 80.
Okay.
And what is systolic?
Okay, that was going to be my next question. Yes. What's systolic? Yes.
Systolic is the blood pressure of the heart at the peak of the heart's, the heart is the pumping organ.
Okay.
So the pressure within the heart at the time the heart is trying to pump out blood from itself, that's regarded as systolic, and that's the one that is 120.
Okay.
Then 80 is what we call the end diastolic volume pressure. That means at that time the heart is relaxing, allowing blood to flow in from the inferior vena cava through bringing blood from other parts of the body into the heart again for another cycle of pumping. So at that time, blood is freely flowing into the heart, and that pressure at that time is regarded as diastolic, and that means there's no pressure at that time.
Okay. Yeah. So the first one is when there's pressure. That's pressure. That full first force.
Yeah. So it has to use that pressure to push out blood.
Okay.
And the other one is the heart has relaxed and blood is flowing, and that's diastolic.
Okay, so that's why when they're measuring your blood pressure with this sphygmomanometer,
yes,
they cough.
The cough measures that blood pressure.
Okay, that first one, okay. Yeah. Right, so we're clear on that. So we know that the systole and the diastole. Now, from the statistics I read at the beginning of the program, it talked about the difference in male and female. Male, especially in the African region. But anything in particular why it's more or it's high in the African region, or is it the same everywhere?
Yeah, if I use the Negroid race, has a propensity for what we call coronary heart diseases, and hypertension is part of that syndrome. where there's a lot of high cholesterol level and clogging up of the arteries by cholesterol. And you know, high blood pressure develops because the arteries, they are not malleable. The pressure within the arteries builds up, so it filters back into the heart. You know, remember if you did mechanics in physics, you know, the heart is essentially a pump, or the blood circulation is essentially a pump and pipes.
Yeah, just like you have a pump in the pipes.
And the pipes.
All over the body.
But the difference here is that in the normal sense, the pipes are rigid, they don't expand. So there's a constant pressure. But for that of a living being, the arteries also are, they go up and down, they are malleable. So when the arteries harden up a little bit, so it means that the heart has to pump harder to push blood through those arteries. So for it to be able to do that, the pressure in the heart has to increase.
All right.
You see? And then, so that's why as people grow older, the hearts harden, the arteries harden a little because of calcium deposits, because of age, and other become less elastic.
Okay. So,
and that means it translates back into the heart, and the blood pressure will start increasing. Once men hit about 60 and going up above 60, age of 60, the blood pressure also starts climbing up a little bit.
Okay.
You know. So, and then for the women, yes, there is a slight higher percentage of men having hypertension. But what normally happens postmenopausal, that's women have passed their childbearing age and they've stopped menstruating, they catch up with the men. In some instances, they might even go a little bit higher than that of men. Yeah.
All right, so it's just, that's just, you know, it will still change eventually, but before they get to
before, yes. That's a narrow difference between men and women, yeah.
Okay, now let's just going back to that hardening of the arteries and the region we stay in. Does it have anything to do with our diet? We'll talk much on diet.
Yes, you know, hypertension is a complex syndrome that is made up of your lifestyle, and that lifestyle can be broken down, your sedentary lifestyle or your active lifestyle, and then also could be broken down to what you eat, when you eat, and how much you eat.
When you eat.
When you eat and how much you eat. Right. So why I'm saying that is that, let's take, for example, let's take diet alone. If you eat a lot of fatty diets, so you tend to gain weight. And it's been shown that the bigger you are or fatter you are, you tend to develop high blood pressure. Okay. And then if you have high blood pressure, it becomes difficult to get rid of it. And by sheer reducing the weight can also reduce your blood pressure. Also, if you eat a lot of salty diets.
Okay, salty food. So number one is fatty food.
Fatty food.
And fatty food, we're talking about...
especially saturated fats
or from processed food.
Processed food.
Okay.
In fact, globally, it's been noticed there's a direct link now to the processed food people are eating to the increase in the blood pressure compared to the older generations because of the processed food people eat. So salt is a major input. And you know, people think that it's only table salt that you have salt. A lot of seasoning like Maggi, all those, they have a lot of sodium inside it because the active ingredient is the sodium in the salt. So it also increases blood pressure. That's why the first thing a doctor will tell you if you're hypertensive is to cut your salt diet to barest minimum. And it's interesting, you know, the body is an adaptable body. If you stop eating salt, after some time, you won't even know the difference. And if you put a little salt, it will be so salty in your mouth.
That's true.
So hypertension is actually a lifestyle thing. And also it's been shown that if you exercise regularly, for a minimum of 30 minutes anytime you exercise, then you have what we call cardiovascular benefits. In fact, exercise gives you two types of benefits. One is what we call musculoskeletal. That means your muscles are toned. You know, I always make just with my female friends as a women's rights activist. I always take jabbers. I say, look, if you exercise very well, you have a figure 8. So you'll be delectable. The men will be looking at you. You know, your husband will be so excited seeing you. And then not only do you have that musculoskeletal benefits, you burn fats as you're doing that. But the other thing is that with that exercise, for you to have what we call the cardiovascular benefits, you must exercise and you must reach a certain heart rate level. and then you must do for a minimum of 20 to 30 minutes. Okay. And it has to be at least 5 times in a week, 5 days in a week, so to say.
Okay, I think we'll have to take that again. So you need to exercise, that's 5 times a week?
That means 5 days in a week.
So yes, 5 days
for a minimum of 30 minutes each session.
Okay.
And there must be a heart rate that you have to attain for you to get
measure that heart rate? You have to run. You figure out that you've gotten to that rate.
No, it's age dependent, and I don't like to give this is something that when you sit down with your doctor, they can work it out because it's age dependent. Because if you also have a heart problem and you start exercising very vigorously, you might get into trouble. So that's why if you feel that you're hypertensive, the most important thing is to have a conversation with your doctor before you even start any form of exercise. Okay. You know, you can grade your exercise: walking sluggishly, brisk walking, to jogging, to cycling, to swimming. Those are all forms of exercise.
Okay.
So you must choose what is good for you so that you won't put yourself under undue pressure. Yeah.
Okay, now, the next thing I was going to ask, what makes hypertension dangerous? Because, you know, it's a silent killer, number one.
Yep.
And maybe that's the first question I should ask. Why is it called a silent killer? You know,
Hypertension is such a unique disease, if I use the word, that you really have said it, a silent killer. You don't know that it's there. It sneaks onto you. And I can tell you, most people who have maybe elevated blood pressure beyond what we've said now, they might be hypertensive for about 10 years without knowing. And then within those 10 years, a lot of organic damage would have done.
And it comes with no symptoms at all?
No symptoms in some people. They won't have any clue. But for people who God have blessed, they might be having headaches, you get the point, and they might be having difficulty in breathing, and when the blood pressure goes up, it might give them telltale signs, tiredness, and all that. But most often than not, it's headache. People who have symptoms complain, or maybe they feel dizzy, or they have blood vision, and all that.
But at this point, it must have gone.
It must have gone very high.
Very.
Some will not even know anything, no matter how high it has gone, until they have a stroke.
Whoa.
Or heart attack.
So that's what makes it the silent killer, because it comes
That's why it's called a silent killer. And that's why we say that it's better to prevent the catastrophic events hypertension will cause. Because, let's face it, what we call essential hypertension means no matter what the person does, the person will end up with high blood pressure, either due to hereditary or it just creeps up on the person.
Because I was going to ask, can it be hereditary?
Yep, it can be hereditary. It can be hereditary.
Okay.
In fact, if your both parents have high blood pressure, you have almost a 40-something% chance of being hypertensive.
Wow.
If one parent is hypertensive, about 17% chance. So you can see the direct relationship with that. So if your parent is hypertensive, then the onus now lies on you to do 3 things: watch what you eat, exercise, and go for preventive health checks.
Okay.
If you go at least once a year to check your blood pressure, as you grow older, every 6 months, you will pick up the fact that your blood pressure has started crawling up. And then, you know, the interesting thing about hypertension on its own does not kill.
Okay.
What kills is the complications that come with elevated blood pressure over time.
Okay.
And I'll tell you the organs. It will first get to your kidney, and it's a vicious cycle. Kidney disease causes hypertension. You know, when we come to causes of hypertension, one, well, essential, but there is one that can be caused due to diseases, and that essential is also like primary hypertension. The secondary hypertension is that something else is causing it. Either you have a kidney disease, or your lifestyle itself is the thing causing it. So when you have that kind of high blood pressure and you don't control it, if it, let's say, is a primary hypertension, you don't control it, it will go and damage your kidneys.
Wow.
When it damages your kidney, it becomes a vicious cycle.
Of course. All right, we are going to hold that thought. When we come back, we're going to discuss more on the causes of hypertension. We'll be right back, viewers, to discuss more on the causes of hypertension. We'll be right back.
Over 1 billion people around the world have hypertension, or high blood pressure. So that pretty much means it's pretty common. Let's start by defining it. Typically, it's represented by two numbers. The top number is the systolic blood pressure, which is the arterial pressure when the heart's contracting. And the lower number is the diastolic blood pressure, which is the arterial pressure when the heart's relaxing or refilling. Most of the time, blood pressure is taken in the brachial artery in your upper arm. Because if the pressure's high there, it's probably high throughout all of the arteries. The guidelines for categorizing blood pressure have recently changed to reflect a growing body of evidence that shows even moderately high blood pressures can significantly increase your risk for developing heart disease. Now, normal systolic blood pressure is defined as less than 120 millimeters of mercury, and a normal diastolic pressure is less than 80 millimeters of mercury. Elevated systolic blood pressure is considered between 120 and 129 millimeters of mercury, and less than 80 millimeters of mercury on the diastolic side. Stage 1 hypertension is between 130 and 139 millimeters of mercury on the systolic side, and between 80 and 89 millimeters of mercury on the diastolic side. Stage 2 hypertension is defined as anything that's 140 millimeters of mercury or higher on the systolic side, and 90 millimeters of mercury or higher on the diastolic side. Typically, both systolic and diastolic pressures tend to climb or fall together, but that's not always the case. Sometimes you can have systolic or diastolic hypertension, when one number is normal and the other is really high. This is referred to as isolated systolic hypertension or isolated diastolic hypertension. High blood pressure is a serious problem for the blood vessels because it causes wear and tear on the endothelial cells that line the inside of the blood vessels. Just like a garden hose that's always under higher pressure, in the long term, blood vessels can develop tiny cracks and tears that can lead to serious problems, like myocardial infarctions, aneurysms, and strokes. Now, about 90% of the time, hypertension happens without a clearly identifiable underlying reason, and we call this primary hypertension or essential hypertension. In other words, over time, pressure in the arteries starts to silently creep up. And there are a bunch of risk factors that we've identified for primary hypertension, and these include old age, obesity, salt-heavy diets, and sedentary lifestyles. With the exception of age, all of these can be improved with lifestyle changes, and those changes can help reduce hypertension. About 10% of the time, though, there is a specific, identifiable underlying condition that's the cause of the hypertension, and we call this secondary hypertension. For example, anything that limits the blood flow to the kidneys, or the renal blood flow, can cause hypertension, as well as things like atherosclerosis, vasculitis, or aortic dissection. This is because the kidneys play a super important role in blood pressure regulation. When not enough blood flows to the kidney secretes the hormone renin, which ultimately helps the kidneys retain more water. That water contributes to more blood in the arteries, making them more full, which leads to higher pressures. Other diseases can also cause secondary hypertension. Fibromuscular dysplasia, which affects young women, can cause the walls of the large and medium-sized arteries to thicken. If it involves the renal artery and limits blood flow to the kidneys, it triggers more renin. Another example is a tumor that produces excess aldosterone, and just like renin, this leads to fluid retention. Finally, if the blood pressure gets really high really fast, it's referred to as hypertensive crisis. It involves a systolic pressure greater than 180 millimeters of mercury or a diastolic pressure greater than 120 millimeters of mercury. Hypertensive crisis can be further split into hypertensive urgency and hypertensive emergency. With hypertensive urgency, there hasn't yet been damage to end organs, like the brain, kidneys, heart, and lungs. In hypertensive emergency, there has been shown to be evidence of damage to end organs. So for symptoms, usually primary hypertension isn't actually accompanied by any symptoms, which is why it's sometimes referred to as a silent killer. Secondary hypertension might involve a variety of symptoms associated with the underlying cause. And finally, hypertensive emergency might involve symptoms like confusion, drowsiness, chest pain, and breathlessness. The first choice for treatment of hypertension is lifestyle changes, like changes to the diet, exercise, and stress reduction techniques. In addition, there are a variety of antihypertensive medications that might be given in some cases as well. Alright, as a quick recap, hypertension or high blood pressure affects over 1 billion people around the world, and over time is a major risk factor for heart disease and stroke. Stage 1 hypertension is defined as 130 to 139 millimeters of mercury for the systolic blood pressure, and between 80 to 89 millimeters of mercury for the diastolic pressure. While stage 2 hypertension is defined as greater than 140 millimeters of mercury on the systolic side, and greater than 90 millimeters of mercury on the diastolic side. Hypertension usually doesn't cause any symptoms, and the first line of treatment is lifestyle changes.
Welcome back. Before we went on the break, my guest on the program has been Dr. Ejike Orji. He's a physician for 37 years and an international development expert. Thank you very much, sir.
Thank you, Angela.
Okay, just before we went on the break, we were discussing the causes of hypertension. But before we do that, I want us to go back to this, the blood pressure, the numbers. So we have the systole, diastole, which is normal, which is abnormal, which is now heading towards trouble, and you call it danger.
Yes, systolic blood pressure should not be from, like I said, before we used to say systolic blood pressure should not be more than 140. Okay. But now the American Heart Association has rebased it last November, and they're saying it should not be more than 130.
Okay.
For it to be normal. Right. And then the diastolic, which is the lower one, should not be more than 80. Before we were thinking about 90. So we believe that a lot of research has gone into this, and then they found out over time that if it goes beyond what we have just said now, it might have deleterious effects on the organs of the body, especially the kidneys and the heart.
Okay, so for a normal human being, you have 120
over 80.
80.
Yeah.
Then if it gets to 130,
80.
130, 80.
So actually the one that is now, if it increases, still allowed, is only the systolic.
Okay.
So the 80 is now rigid. If it goes beyond 80, that means you're heading towards light hypertension.
So anything you're doing, stay within 80?
80 at the diastolic.
Wow.
But you have the luxury of getting to 130 for the systolic.
Okay.
Yeah.
Okay. So when do you now start to worry? After 130, now you're climbing there. It's possible you can get to 150, 170 for the systole. Then the diastolic, well, 80, 90, you start to worry.
If you get up to 90, you have to worry. Well, they're even saying once it goes above 80, you have to start worrying to make sure you bring it back what it should be. Okay. And the reason why it's even important that people know this is that it's not all people who are slightly hypertensive will use drugs.
Okay.
Just ordinary lifestyle changes can change and bring down the blood pressure.
The blood pressure.
It will just a tiny cohort of people that will eventually will have nothing to do but use medication. Okay,
so a large percentage is just change in lifestyle.
Change in lifestyle that will bring down the blood pressure.
Bring everything back to normal.
Keep it under normal.
Okay, and this happens. The normal changes with age, isn't it?
Although,
the older you get.
Yes, the older you get, the blood pressure will start climbing up. Also, in the teaching before, we used to say once you're above 60, you can be allowed a blood pressure of about 160 over 95. But the recent studies are showing even at that age, it should not be more than 130, 80.
So it's possible to have individuals that are over 60 and still have good, if they have done what they need to do, and still have normal range of blood pressure. Yeah,
my blood pressure remained 120 over 70 for so many years.
Wow.
My blood pressure as we speak now, normally is about 120 over 75.
That's
occasionally it goes beyond 80, maybe 85 when it comes down. And there is something we call the circadian cycle of blood pressure. If people, their blood pressure is lowest at night when they're sleeping, and then starts climbing up in the morning. You know, but God has done it in such a way, it prepares you for the day, because you need a good blood pressure to go around the normal distance of the day. So at night, when you don't need your body to move around, so it calms really down, and you're relaxed too. Remember, everything has to do with playing on the arteries. And that's why people who have insomnia, they don't sleep well, they have the tendency of having high blood pressure. People who have apnea, sleep apnea. Sleep apnea means you stop breathing momentarily.
Okay.
Because people who are a little obese, so they stop breathing momentarily, so it builds up a lot of toxins in the body, and then their blood pressure will also shoot up. Okay, you know this. Okay, sorry. And that's why for people like us who believe so much in preventive healthcare, we are so, you can see I'm wearing a wearable. Okay, so this is a wearable technology. It's measuring my blood pressure, it's measuring my heart rate, it's measuring my breath rate, it's measuring how many steps I take in a day. Okay. Like for my age, I should at least do 5,000 steps in a day. In a day. So it's measuring how many steps I'm taking. I can also measure my what is it called? My ECG. Okay. At some point, if I feel I should check my ECG and make sure my heart is functioning well, I can measure my ECG, and it's attached to my phone through an app. Wow. Okay. Or just Bluetooth, and then there's an app. So which means you monitor the progress of your heart? Yes, every 120 minutes, every 2 hours. Wow. It checks all those automatically. All I need to do is, and I'll check it. If for any reason I want to check my blood pressure at any point in time too, all I need to do is load the app and then keep it steady. Within 20 seconds, it will tell me my blood pressure. What is happening. So it's important, and people, you know, there's something we call the Coulter counter in those days when you have people, some people have what we call labile blood pressure. Their blood pressure shoots up, comes down, shoots up, and it's very dangerous. Yeah, because and then it's possible that when they went to the doctor to check, is the time the blood pressure is down. You say the person is not hypertensive. And when the person goes, at some point, it goes up. So with this wearable, the doctor can just look at your distance and see over a 2 or 3 hour period, or even a whole day, can now plot a graph of your blood pressure and know whether you are in trouble, whether there should be something that should be done about your blood pressure. Okay. So technology has advanced so much. Nobody needs to die from preventable causes anymore. So what I'm just thinking is, you know, before you can actually say somebody is hypertensive, you have to have a long period. No. You can't just take one blood pressure check and say the person is hypertensive. Okay. You must check over time. Okay. But if it's malignant, let's say somebody comes in one blood pressure of 170, 100, you don't have to wait, and after about 30 minutes you check it again and you stay 170, 100. Yeah, then you know you need to admit that person and start doing something before the person, you know, has a heart attack or a stroke. Okay, let's go back to what we're discussing, causes. You know, we talked about the kidney, the effect with the kidney, you know, when you have high blood pressure, it affects the kidney. And you said there are other organs that are actually, so let's talk about those. Yes, apart from the kidneys, another important organ that the high blood pressure damages is the heart. Okay. And that's why what it does is that the heart, because, you know, something we'll call functional hypertrophy. Okay. God has made our body in such a way that anything we do all the time with any particular part of the body, God has made our body to become more efficient to be able to do that. Okay. And I'll give you 2 examples. If you look at footballers who use their legs and feet to kick around, if you look at their calf muscles, it's well developed. Yeah, because of what they do. What they do. If you look at weight lifters, their muscles and their biceps and their chest muscles is well developed. Okay. If you looked at boxers too, their biceps are well developed. And then if you look at even the normal person who is not doing any type of work, say if you're right-handed, if you check, you find your right hand is bigger than the left hand. Yes. Because you use this all the time. It's functional hypertrophy. God has made it in such a way that that part of the body gets stronger, gets a little bigger to be able to do that work that it's supposed to do efficiently. Yes. So the same thing happens in the heart. If the heart is exposed to higher blood pressure than normal, the same functional hypertrophy happens in the heart muscle. It starts getting bigger to be able to have the ability to pump blood through that rigid artery that has made the pressure to go up. Now, the other problem with that of the heart, or challenge I will say, is that the blood pressure to the heart is not like the blood pressure to other parts of the body.
Okay.
The blood pressure to the heart is usually one single artery going to one part of the heart muscle. Unlike where you have what we call collateral blood supply. If you cut somebody's skin, even if you do not suture it, the other part of the distal part of the skin, blood is going through and going back and supplying that area, but it's not like that in the heart. So, and what happens in hypertension is that as the heart is growing bigger and bigger and bigger, that means it will need more oxygen to be able to do its function very well. And then usually too, for people who are hypertensive, the same thing that had clogged the arteries, the cholesterol or high cholesterol level, that had clogged the artery and made it rigid. The same thing is happening in also the small arteries of the heart.
Okay.
So at some point, the heart will not get enough blood or enough oxygen, so the heart now fails as a pump. And that failure as a pump is what we call myocardial infarction. Because the arteries have narrowed so much, it blocks. And once it blocks, that means no blood goes to that part of the heart. So that part of the heart dies, the muscle dies. So that means, remember that the pump of the heart is controlled by electrical activity. So once the sequential spread of that electrical activity is what makes the heart pump in a very efficient manner. So once that electric activity can't pass through, so that means the heart can't pump well and the heart fails as a pump.
Wow. So
then the second thing that happens also, as the heart is growing bigger and bigger and bigger, the valves, remember the heart, the valvular part of the heart opens and closes, opens and closes. So those valves, when the heart grows bigger, they separate and they start leaking.
Oh.
And that's why people with extended hypertension over time, who their heart has become so, call it cardiomegaly, big heart, it fails as a pump. So the heart is unable to return all the blood that comes to it, some of it that pulls. And that's why people it becomes heart failure. And that's why you see people with heart failure, their legs are swollen.
Wow.
You see how the symptoms are picked. So when you see somebody with hypertension, with swollen legs, and then difficulty in breathing, when the person goes a little bit, the person starts panting. It means that the heart has failed as a pump, there's a leakage, and the blood is pulling.
Wow.
So you see the cause and effects.
Wow. So that's what makes it a very, very serious problem when it comes to.
So and that's the third organ the heart can damage, and that one, if you're lucky, gives you a chance, is the brain.
I know the brain cannot be starved of oxygen for
3 minutes. It's finished. Even the heart, 3 minutes, the heart will stop pumping too. So what normally happens for the brain also is that because of the hypertension too, the blood pressure is coming in so high, it can burst an artery. Once it bursts an artery, the blood will flow into the listing of the brain, the tissue of the brain. And at the same time, remember, that artery is supposed to supply a part of the heart, a part of the brain too. So that part of the brain will not get that blood. So you have an ischemic, that's why it's called an ischemic attack. Or we call cardiovascular accident.
Okay, and in this case, at that point, nothing can be done in your own case?
It depends. It depends on the level.
Okay.
A lot of people survive strokes. Depends on the level or the level of the. If it's a massive stroke, the person will die instantly. If it's a small leak, the person will have paralysis based on the motor function the heart, the brain controls, and usually it's one side, depending on the hemisphere part of the brain that is affected. So the person can one hand and one leg, either the left or the right, you know, so to. But like I say, modern medicine, if it's picked up early, it can be managed and the person might recover full function. And then usually too, some people are lucky, they have what we call transient ischemic attacks, TIA, in the brain. So the person now finds out, for one reason or the other, the hand is weak or the leg is weak. And they will, once they check the blood pressure and see that it's high, and they take the person to the hospital. When they get to the hospital, when the doctor checks the blood pressure, it's normal.
So that's the sharp.
And that's where experience comes. An inexperienced doctor will feel, there's nothing wrong with this man now. You get the point. But an experienced doctor will know that God, in his infinite mercy, has actually given you a notice. So that means from then on, you must aggressively manage that blood pressure. Because usually, when they have another attack, it's usually fatal. And that's why most people who have had a stroke, no matter how small or big, when they survive it, if they have a second one, they hardly survive it.
Wow.
So it's a wake-up call. If you have a transient ischemic attack, and the doctor picks it up, it's a wake-up call. It's a wake-up call. Look at your lifestyle.
Start making necessary
changes. Look at your diets, and then look at your personality. Remember, I had mentioned most often than not that it is diets, sedentary as opposed to exercise, hereditary. But there is a fourth one, your person type. Your person type. If you're a worrier, if you worry too much about little things, or even big things. If you are a perfectionist, somebody that if you come home, if the book is not properly arranged, you see them arranging, and they are every time.
They're getting worked up over everything.
You get worked up. If you're somebody that is unforgiving, and that's why the Christian life is one of the most important things in life. If you are Christian-like or Christ-like, that means you forgive easily. The act of forgiveness removes the burden of whatever happened, actually have put it on the head of the person who have wronged you.
Okay, let's just ask on that question before we go on a break, because there's studies that are coming up now that there's a relationship between people that are forgiven and easily let go of things, just in line with what you're saying. They tend to have, you know, less of blood pressure. It's just some of the studies that are coming up using here and there. You don't need
a research person to tell you. Worry destroys you as a human being. Envy destroys you.
Worry, envy.
Wickedness destroys you. Jealousy might not, because there is a healthy jealousy. You get the point.
That brings about good, healthy competition.
Yes. But you see envy, you see wickedness, you see lack of forgiving hearts. Those are destroyers, and it impacts on your blood pressure.
Wow.
And then what we call executive stress. If you work too much and you worry about the outcome, it's not really how hard you work, it's how strategic you work.
You are working.
You're working that is important. That's why you can see a lot of people they are multitask, they do this, they do that, but if you check their blood pressure, it's okay.
Because they've learned how to balance things and prioritize. And not working hard, but working smart.
Working smart and working strategically.
Working strategically. Okay, we'll go on a quick break. When we return, we'll then go and talk about cure or how to manage hypertension, and also we'll talk about hypertension in women, which I know you're very interested to talk about. All right, we'll be right back.
Lower blood pressure quickly, cure hypertension naturally. Not treating high blood pressure is dangerous. High blood pressure increases the risk of heart attack and stroke. You can live a healthier life if you treat and manage it. Blood pressure is written as two numbers, such as 112/78 mm of mercury. The top, systolic, number is the pressure when the heart beats. The bottom, diastolic, Number is the pressure when the heart rests between beats. Normal blood pressure is below 120/80 mm of mercury. If you are an adult and your systolic pressure is 120 to 139, or your diastolic pressure is 80 to 89, or both, you have pre-hypertension. High blood pressure is a pressure of 140 systolic or higher, and or 90 diastolic or higher, that stays high over time. You can also manage your high blood pressure with natural remedies. Lower blood pressure with raw almonds. Raw almonds, when added to a healthy diet, can help influence lower blood pressure levels. In fact, almonds are included in the dietary approaches to stop hypertension. In the diet, almonds are included in the nuts, seeds, and legumes group. The diet recommends eating 4 to 5 servings of this food group per week. With regard to almonds, 1 serving of almonds is just 1/3 cup. The healthy monounsaturated fat in almonds contributes to lower blood cholesterol levels and reduced arterial inflammation, which ultimately helps lower the pressure inside the arteries. Here is the best way to making almond milk. It is easy, it tastes better than store-bought almond milk, and it has 0 artificial ingredients in it. You can make it with a juicer. Step 1. Soak almonds overnight in 3 cups of water. The soaking process makes the almonds soft enough to juice. Step 2. Pour out the water and rinse the almonds thoroughly. Make sure you rinse until the water runs clear. Step 3. Add 3 cups of water back into the bowl. Step 4. Set up your juicer and turn it on. Step 5. Slowly start adding a large spoonful of almonds and water into the top of the juicer. Step 6. Continue adding almonds and water into the juicer. Step 7. Stop when the pitcher is full. Then strain the almond milk through a mesh colander or cheesecloth to remove any leftover almond pieces. Step 8. Add any necessary flavor to the almond milk, like vanilla extract and stevia.
Welcome back. Before we went on the break, we were still discussing hypertension, and my guest is Dr. Ejike Orji. He's a physician for 37 years and an international development expert. So, before we went on the break, we discussed, of course, the causes. Now we want to go and want to see, can hypertension be cured? All this that we have said, can it be cured? Oh, that's a tough question to ask.
No, it's not a tough question.
Okay.
Hypertension, if it's established, cannot be cured. It can be controlled.
Okay. Controlled.
Okay. So it's good for it to get into people's heads that it cannot be cured, but it can be controlled. And like I said before, if it's controlled and your blood pressure is within normal limits, you don't need to worry. You live like any other human being till death do you part with the world. Okay. You get the point. Okay. But the direct cause of your death will not be hypertension.
Of course, it's as a result of other...
Maybe other things.
Other things that have come up in the body. Okay, so how do you... Now, it's been established that you're hypertensive. So how do you now start managing the...
Once you establish that you're hypertensive, you need to have a conversation with your doctor.
Okay.
Depending on the level, if it's very severe, I will advise you will be managed by a cardiologist. Okay. And a cardiologist is a doctor who has qualified as a doctor and now did a sub-specialization on issues of the heart. Now, there are 3 ways or 3 things that might happen in your own case of treatment. One, like I said, lifestyle changes can actually keep it at bay. Second one is the introduction of medication. And then, of course, the third one is you need to change who you are.
Okay.
Remember we talked about envy, wickedness, and a warrior, and a perfectionist, unforgiving spirits. You need to really work on that. Okay. You need to work on that. And then, of course, lifestyle changes speaks to issues of exercise, issues of diet, issues of your weight. You get the point.
And just on a general, what kind of diet should an hypertensive person to be looking to go more on? that is healthy, you know, because we know now that cholesterol, high cholesterol has already caused part of the damage. So
one of the key things, like I said, diet, the first and most important thing that has to get out of your diet is salt.
Salt, number one.
Salt, number one.
From any form?
Any form.
Of seasoning?
Any form at all. You must avoid a lot of salt.
What exactly does salt do? Why is salt the bad guy?
It's somewhat called the sodium pump.
Okay, all right.
You got the point. So the second one is fats. Fatty foods, and then saturated fats are the most dangerous, and then the ones that can introduce cholesterol in your blood and increase your cholesterol, that will clog up your arteries and further narrow your arteries.
Okay, so when we talk of saturated fat, I try to remember the teachings I've always had. It's fats that are hardened.
You can congeal
at room temperature. Okay. For example, palm oil.
Palm oil has a lot of cholesterol.
Yes. Okay.
It's one of the highest distance of cholesterol. The other one is red meat.
Okay.
Red meat of any form, bush meat, whatever you call it. The only thing that doesn't have a lot of cholesterol is white meat, and we're talking about chicken, fish.
Okay.
And then the chicken, remember, the skin, you have to remove the skin.
Okay.
You get the point. Even though too, some studies came out some time ago that cholesterol from diet is not really the culprit.
Yeah, I think, I read something that it's...
But I will tell you, I want to err on the side of caution. Just stay away from cholesterol food if you can. And I give myself as an example. In 1992, when I started working with the Deutsche Clinic for Diagnostic, I did my comprehensive check, and I found out that I had a high level of cholesterol, but I was on the high side of normal. But when we did the fractions, remember that the cholesterol is not just doing cholesterol, you have to do the fractions. There's high density lipoprotein and there's low density lipoprotein. Then we found out that the high density lipoprotein was low, but the low density lipoprotein was the one that was high, but it was on the high side of normal.
Okay.
So what did I do? Two things I did. I changed my lifestyle. I did more exercises and I cut off red meat completely. Those were the only two things that I did. The following year, I repeated it in our hospital in Wiesbaden, in Germany. It was still high, but you know what has happened? The fractions changed.
Okay.
The high density lipoprotein now came very high, but still within normal. The low density lipoprotein came down very low. So
you want to have more of the high density lipoprotein?
The high density protects your heart.
Okay.
Protects the major organ, your heart. So that's why you must be very careful. So when people say, regardless of what the study has said about cholesterol, I just want to, if I had continued, there was nothing else I did. I just increased my exercise level and then switched the meats.
Okay, so what kind of food gave you high density lipoprotein? Because in this part of the world, people... Fish, okay.
Fish is the highest source of such this thing.
Okay, so you're talking about things like omega-3 and...
Omega-3, all those things, you get the point. Another thing too people must pay attention to, people also forget, alcohol is dangerous.
Which is very common now.
Alcohol is dangerous for people who are hypertensive. If you're hypertensive, you reduce your alcohol intake to the barest minimum if you can avoid it completely.
Okay.
All right?
Alcohol, would you know, because there are different kinds of alcohol.
From beer, spirits, wine, even though some people say if you can take one
glass of red,
there's a social drinking, maybe one bottle of alcohol a day won't do you any harm. People say wine actually has some good effects on the heart. Alcohol is alcohol.
Okay.
So take in moderation. But if you are established severe hypertensive, throw it away completely, not even a drop.
Okay. All right.
All right?
Okay.
So it's important that people understand that.
Okay.
And then remember what I said, the most important thing is that once you are diagnosed hypertension, you must cling to one doctor. Don't change doctors from one doctor to the other.
Okay, because that doctor's...
You must have a doctor that has a historical perspective of your medication. Because usually the doctor in the first 1 or 2 or 3 months will be titrating your drugs to see the best fit for you that will make you compliant. And that's why in those days, when you are hypertensive, you are given 3 types of drugs. You are given a sedative, you are given a diuretic. Diuretic is one that will make you pass a lot of urine, and the result that is reducing the absolute volume of your blood and mechanics, remember physics again, and that will reduce the blood pressure. And then the other one is maybe, if it's what we call a beta blocker, to block, reduce your heart racing so much. So, and then there are other combinations, calcium antagonists like nifedipine and all that. All those ones, it depends on the cardiologist that is managing you. So, but the important thing is that stick to one doctor. And that one doctor will now have your historical perspective and will titrate your drugs in such a way that you will be compliant, because there are a lot of combination drugs now. Some drugs have 2 drugs in one tablet. So compliance is very important in high blood pressure. If you give the patient so many drugs, the chances are that the patient will not comply. If the patient does not comply, it's not that the patient wants to die, but it's just about, we are human beings. There's so much to do.
And discomfort.
So if you, every morning you take this, one day the patient, all these drugs I'm taking, I beg, let me leave this one, bro. But if it's one drug, you can titrate that patient to, that has a combination therapy. Then the patient will know either taking 1 tablet a day or maximum 2 tablets a day. All right? So the patient can comply. Because what is the, I always tell fellow doctors, what is your goal? When you see a patient, ask yourself, what is your goal for this patient? Is it just to hand over a prescription? Your goal is to keep him alive or her alive, but healthy. Some people can be alive, not healthy.
Not healthy, of course.
There's something the Igbos normally say, that means you're alive, but it's better that you're dead. I don't want that kind of life for my patient. I want to see that my patient, not only that is alive, is healthy and enjoying life to the fullest. That should be the goal of any doctor.
Wow. Okay, well, that's trying to manage hypertension now. Now, let me talk about it before we go. Hypertension in women, pregnant women. It happens, you find women, when they're pregnant, they find out that their blood pressure is high and it becomes a bit of a problem. What's responsible for such?
Just if you look back at the physiology or pathophysiology of hypertension in pregnancy, or even the physiology of pregnancy, you will find out that it's a hyperdynamic situation. Okay? There's a lot of hormones dancing around in the woman. The woman gets bloated up. The woman is now catering for another human being growing inside her. So what normally happens, all the functions of the body stretched, including that of the kidney. So in some women, they have what we call glomerulonephritis, a very low-grade problem in the kidney. Which ordinarily they move around, no problem. But when you now come in the dynamics of the pregnancy, that thing now overwhelms the kidney. The pregnancy overwhelms the kidney. So the patient will now develop high blood pressure. Remember that I said before, kidney disease causes high blood pressure.
Yes.
So that's what normally happens in those women. Some might not progress to eclampsia, because eclampsia is also hypertensive diseases in pregnancy. And eclampsia is when you now start seeing protein in the urine, and the legs are swelling. The person now pre-eclamptic, and that's dangerous, and it happens from 20 weeks of pregnancy and above. And in some cases, the only way you can save the woman is to bring her that pregnancy. Okay? So if you look at that, so in pregnancy, that's how any woman that is pre-eclamptic, that is hypertensive and in pregnancy, needs to check the kidney and check it properly. In some cases, after the pregnancy is gone, the high blood pressure disappears. But in very little, small amount of people, the blood pressure can continue after that. So it becomes the same thing. Hypertension, no matter how it comes, the management is the same. But for a woman that is pregnant, you won't tell her to go and start jogging up and down. So it's drugs. You use certain drugs, and then not all the types of drugs that you use in ordinary hypertension that you also use in pregnancy. So that's why the gynecologist and the physician will now combine to manage the patient.
Manage the patient.
Yeah.
Okay, but there's nothing. Okay, when she sees the doctor, then she will have, you know, physician. Then she knows what to do, you know, with regard to keeping herself. Yeah. You know.
But the most important thing also is weight. If a woman is overweight and going into pregnancy and has pregnancy-induced hypertension, it becomes much more difficult to manage also. Okay, so you see, that's why weight is a key thing. It's one thing we can manage ourselves.
Yeah, just by changing your lifestyle and the way you
change your lifestyle.
Smoking as well can.
Smoking, yeah, smoking is a terrible thing in hypertension. It's even worse in pregnancy. Yes, remember, I mentioned alcohol. The other one I forgot to mention, thank God you brought it out, is smoking. Smoking is terrible for hypertension because it affects the arteries also. So it's good if you're diagnosed with hypertension. Even if you smoke 1 cigarette a week, throw that cigarette a week completely. Completely,
and then stay. Yeah. In fact, everybody should, if possible, stay away from.
I don't see why any human being should be smoking. There's a direct correlation between cancer of the lungs and smoking now. Yeah, it's not hearsay. There's a direct correlation.
Because almost everything has the effect of alcohol and smoking. Yeah. They tend to have some effect in, you know, changing the whole body system. Yeah. Okay, so to prevent it really, from what we've said, is basically maintain a good lifestyle.
A balanced lifestyle.
Balanced lifestyle. Lifestyle should be.
In fact, I have what I call the wheel of life.
Okay.
The wheel of life with 7 parameters. You must seek balance for all those 7 parameters.
Okay.
You know, and I tell you what they are.
Okay.
1, you must do your preventive health checks every year.
Okay, preventive health check every year.
You plot it on that wheel of life, and you know the wheel turns. So, and then that becomes one of the spokes of that wheel, and then you score it. Then the other one is that you must have spiritual balance. You must have a good relationship with your God. That's spiritual health. You also must have good spousal health, and that spousal health is between you and your spouse or your partner, as it might be. The other one is financial health. Financial health means you must be at peace with yourself. You must be content with what God has given to you.
Which is a major issue. People, you know, money is always...
Money is a big problem. People who even have enough to feed themselves, they want to drive a Lamborghini because they have a little. Meanwhile, the function of a vehicle is to take you from one point to another. Then the other one, you must have a social life, social healthy life. You must be able to, you know, interact with other fellow human beings and seek balance in that. You get the point? And then the other one is what I call the work life. If you see somebody, anytime he or she wakes up in the morning and is willing to work, that means he's happy in the workspace. But if person says, oh, I'm going to meet this nasty boss, I'm going to meet all these miserable people, that's not balance. You see, there are 7 of them. And now what I normally do is draw it, and then if you find out and score from 1 to 5, from the fulcrum to the outer part of the wheel. If any of those spokes, you draw them, they are not up to 5. That means when you are riding that wheel of life, it will be jerky because it's not smooth. And then if you look at that, if you're able to look around your life, because it's not a one fit that causes all the problems. There's a direct correlation between the mind and disease. Social interaction is key. But there's this thing that's making the social media now, that the ability to interact, meet a lot of people, be happy with people is the most important thing for longevity.
But that's why we have other human beings with us, isn't it? That was why God put other human beings so that you can relate.
But you know, a lot of people have problems with fellow human beings. Either they want to dominate wherever they are, they want to be seen as the only person, or they don't want another person to get whatever that is due. And if you look at what is going on, even politically, all this restructuring, people just feel they're not getting their due. That's why everybody's talking about restructuring. The ability to let go, the ability to live and let go and let live, there's nothing like it. So at the end of the day, it's seeking balance.
Okay. So
the most important thing that gives us that ability to seek balance is being Christ-like.
Yeah. Because he lived the perfect life of knowing how to balance everything. Well, okay, now we've talked about prevention, lifestyle, and then I like the whole we'll stress on that, you know, as the episode continues. But now, just finally, before we go into to talk about the last part of the show program today, relationship between hypertension and diabetes.
For people that are diabetic, one of the exits is hypertension and complications of hypertension. Diabetes, one of the major complications of diabetes is hypertension. The reason is that the diabetes also damages the kidneys. You see the roots.
This kidney.
The damage of the kidneys will now lead to hypertension.
Hypertension. Okay, of course, because of the heightened level of sugar and... The
heightened level of sugar causes what we call at the ultra level. I don't know how to describe it, you know, I don't want to be too medical.
Okay.
You know, the arteries that supply blood to the tiny vessels, or to the tiny should I say, tissues and nerves in the body.
Okay.
Because in diabetes, it gets clogged up also, and that's why people have amputation of the feet.
Okay, yeah, when they have.
So that's thing that also happens at the feet that gets cuts off, also happens in the kidneys. So it now compromises kidney function.
All right.
You see the point? And then because the kidney has been damaged, it will also lead to hypertension. It becomes a vicious cycle.
That's how the body.
That's why diabetics are told to make sure they keep their diabetic status controlled rigidly. If they don't, the kidneys will suffer. In fact, in some people, no matter how much they try, eventually the kidneys will be damaged. No matter how much they try to keep the diabetic status, eventually the kidneys will be damaged, and then it will lead to hypertension.
So the kidney has a major role to play in especially hypertension, because it talks about diabetes a couple
The kidney is a very central figure, if I will use that word, a central organ in hypertensive outcomes.
Because everything goes, of course, almost the blood has to run through the...
It's the kidney that removes all the nitrogenous waste products.
The waste from...
The kidney and the liver, those are the major organs that, you know, get rid of all the toxins that would have killed us, that we eat on every day, and then make sure they goes out either through fecal matter or through urine, or we'll sweat it out.
Okay, at this point, let's talk about GeroCare. Yeah, that's what it's called?
Yep.
The organization, what you're doing. That's
Dr. Ejike Community Development Foundation. Yes.
What is this about?
It's my foundation. I founded years ago when I quit the international development space to go to politics. And then during my politicking, I saw a lot of things, and then I decided to set up the foundation. As an international development expert, I have core competencies in running a not-for-profit. And it's within the ambit of that not-for-profit that we're doing a lot of things. So we're working with another organization called GeroCare, who developed an app to be able to get information from doctors when they have seen a patient and recruit doctors. So what we do is that doctors are sent to our parents, especially our parents, like we are all living here in Abuja.
Mainly for elderly, yeah?
It's actually for everybody, but the target initially was for elderly. We are all living here. Most of us have our parents living in the village. They've retired and decided to go and live in the village. Some, they have been working and living in the village all their life, where their children are now in the town, in the cities, working. Often, most of our aged parents would not want to disturb us. They feel that the person has so much trouble already. Why should I have lived my life? Why should I add my own? Meanwhile, they have a health issue. And one thing they don't also understand is that when they have that major health issue, it becomes a problem. It's the same person you say, I don't want to bother, that will
run around to get you fixed when you run.
And the label now always say prevention is better than cure.
Yes.
And I give some of my friends an example why they should sign up on this sort of thing.
Okay.
I'm from Abia State. If I have to go in an emergency basis and I fly to Abia, the minimum it costs me to go and come is about 100,000.
Of course.
You get the point?
I know that route.
So if I have to run to go for my elderly relation, my father and my mother, they're all passed on.
Okay.
But I have also relations that I take care of. So if I have to run, if they have a major issue, it will cost me at least 100,000 naira. You know? But some of those things that will make me run are all preventable. You get the point?
Yes.
And with that 100,000 naira, I can actually, because it's 6,300 a month.
Okay, that's the charge for...
Yes, and if you pay for 3 months, you get 1 month free. If you pay for 1 year, you get 3 months free.
Wow.
So, but what happens, a doctor, a general care doctor goes to that person, wherever the person is in Nigeria. We have more than 1,000 doctors scattered around the country.
Yeah, I can see that, the network of over 1,000 doctors all over Nigeria.
So wherever the person is, the doctor will go and see the patient there. Minimum, we have what we call quality control or standard operating procedures. You must see that patient for a minimum of 30 minutes.
Okay.
You clock the patient, you examine the patient, and you find out if the patient is on a routine medication, make sure the drugs are being taken and taken properly.
Okay.
And they are distant. And if for any reason you run into the patient when the patient has a problem, you make a diagnosis and write a prescription for the patient.
Wow.
And then do all make sure that the patient does all the investigations, but that's a separate charge.
Okay.
The only thing that the consultation is at 6,300.
Okay.
That way, a lot of people are saved the trouble of wondering what's happening to my aged parents. And then the good thing about it is that immediately the doctor is done, you
get the information
through the app.
Wow.
It's uploaded on the app. You get it on your phone immediately, real time online.
Wow. And all this for 6,300.
For 6,300.
It saves you the 100,000 of traveling if you're going to Abia State. I mean, with that, you can sit for 1 year and not
for more than a
year.
Yes. For about 1.5 years.
1.5 years, not be stressed about. Wow. Thank you very much for coming on the program. I think we recommend this for everyone to
Thank you.
To try. Thank you very much for coming on the program.
Thank you, Angela.
It's been a wonderful few hours with you. And, well, for the past 45 minutes, I've been speaking to Dr. Ejike Orji. He's a physician for the past 37 years, and he's also an international development expert. I believe today you have learned a lot on hypertension. You know how to prevent it. You know even the social part of it, which I find very interesting, and I hope you did as well. We will see you next time. My name is Angela Mwenze. Goodbye.